All right. Hello, everyone. I wanted to introduce myself. My name is Sharice Eckenrode, and I am with Brown and Brown, and we are your insurance broker's office. And we are here to discuss your open enrollment. That's what we are going through in the next week or so. So, open enrollment is a time when you get to change your current benefits. You get to add or delete dependents. You get to change some of your coverages that you want, and it's a great opportunity for you to make any of those changes and ask questions. Your open enrollment begins on today, 6/8, and it will go through Sunday, which is 6/14. That'll be your last day that you can go out onto Employee Navigator and, excuse me, go out onto ADP and enroll. And I think most of you probably were uh, uh, enrolling through ADP last year. So you kind of have an idea of what it looks like. So in a nutshell, you will log into ADP. And when your enrollment screen comes up, you will click on that, and that from there you will see different options for enrolling in medical, dental, vision. There's also what we call voluntary benefits or worksite benefits, and those are the accident, they are the hospital indemnity, your voluntary life insurance, things of that sort. And within that screen, when you're going to follow a wizard, so you'll start screen number one and you'll continue through all of the benefits. And within those screens, when you click on the actual plan, uh, different plan options will come up once you click on that, like medical plan benefits, right? And different plan options will come up. And on that screen, you will also see at the top where the benefit plan name is, you'll see additional details. I believe that is correct. So the name was additional
Yes.
details. And you'll click on additional details, and all of the information on that coverages for those plans will show up. That way you get to view that. We're going to go over those same coverages here in this benefit guide. But again, the benefit guide is just kind of a brief overview of the benefits. If you want a little bit more detail, then you would find that on those screens. And once again, we are always here to help you and answer any questions. So if everyone is ready, yep, Karen's going to open up the benefit guide for us.
All right, everybody can see it.
We have some thumbs up saying
Yeah.
yes. All right, fantastic. All right, so let's open up to our first page, please. And that is our introduction page. Here it just kind of states when open enrollment is. It talks about what types of things are going to be included in this benefit guide. And we're just going to go down. I'm going to peruse over it just very casually. We're not going to read it line by line or detail by detail. That way, it just gives you an overview. And then again, you can look at it in more depth as time moves on in the next week. So the first area we're going to talk about is you have new hire eligibility or you have open enrollment eligibility. New hire is when you are new to into a new employee, excuse me, to the company, and your benefits would be available on the first of the month following 60 days. In this case, most of you will be going through, you're not a new hire, you are reoccurring in the enrollment system. So you're going through open enrollment. Again, like I had mentioned before, this is the time for you to decide, analyze your family needs, and from that point then, and you can decide what kind of plans you want, if you want to change your plans up. And the only other time outside of open enrollment that you can make a change to your benefits is if you have something what the government calls a qualifying event. And that means certain circumstances have changed in your household. You've gotten married, you've had some extra children come in, you've become a guardian of children, have a divorce, any types of things that are going to change your personal status, whether it's a family status or your individual status, will lead to a qualifying event, which opens the window for you to then change your benefits. So that's a little bit about what this page says. And so for today, we'll be going over open enrollment benefits. So let's go on to that employee perks page. So what happened this year with open enrollment? We do have some changes for you. We have gone in and your and benefits team has decided to look at different options for you for your medical and dental and vision. So what we did was we went out to some carriers and we found the best rates and the best plans to meet all of your needs. And so what we have is medical is now moving from Florida Blue to United Healthcare. And United Healthcare is a very large national network. There is many, many providers, so you won't have an issue necessarily with finding providers in the network. We also have changed what we call ancillary benefits, or you would know them as vision, dental, again, those work site benefits, the hospital indemnities, the voluntary life insurance, things of that sort. We have moved to Mutual of Omaha. Last year, you had Mutual of Omaha for your life insurance policy, your voluntary life, and now you'll have it for all of your voluntary benefits. United Healthcare will cover your medical as well as you'll use United Healthcare for your dental and your vision coverage as well. So we have moved from Humana to United Healthcare for dental and vision. And let's go on to the next paragraph down below. Just wanted to let you know that your life insurance also has a free to you employee assistance program. And what that is, that's you can call a counselor online to discuss any issues you may be having, stresses or just concerns. Just if you need to talk to someone, they have this program available for you. And we really suggest that you reach out to them. You can talk to them about financial issues all the way up through to mental health, to physical health, and they are an incredible opportunity for you, incredible resource for you. And that comes with Mutual of Omaha, as well as you have a second employee assistance program that United Healthcare offers along with your medical plan. So you can go in, and again, these are fully confidential. Your company nor I, as the broker, will know that you called. We will not know of any of your conversation. We will not know what your reason is. It's just for you privately and confidentially to reach out. The next plan you have is the 401k retirement plan. And most of you remember from last year, it's the same plan and the same carrier that takes care of that. And lastly, we brought back this year the earned wages access, which is your cash in advance of your payroll that is pay active. That as well, you have the opportunity to enroll in that this year. So our next page is our contacts page. And you'll see you can reach out to myself. I have a team member as well on your team. Her name is Angela. Her and I both can handle any of your benefits questions you may have. We will take care of any of your claims questions, benefit questions, just general questions in general about how your plans work. Please reach out to us. We're always happy to help you for sure. Down below that, down below mine and Angela's name and contact information, you will see the contact information for United Healthcare, for all of the other carriers, as well, the Mutual of Omaha, as well as for your contact information for both Karen and Stephen on your benefits team. So you get phone numbers there and also email addresses as well as website addresses to go out to. But again, you're always welcome to reach out to Angela and I. And down below, lastly, the most important piece on this page is your annual notices. So the government requires that for benefits that we as brokers make sure that all of you are aware of your notices that the government puts out. For example, one of the example in these notices is your Medicare Part D. And what that is prescription drug coverage for Medicare. And why it hasn't something to do with you, you're wondering, okay, if I'm not on Medicare and I'm rolling in the group plans, what it is that when you are ready for Medicare eligible, the group, your company sponsored medical plan, their pharmacy part of it needs to be credible, or it needs to be in line with that of Medicare. If it's not, then your Medicare cost for prescription will be a little bit higher. So that's just something, it's a notice that the government wants to make sure you're aware of when you are enrolled in group insurance. And so that's just an example of one of the notices that are in there. So what you will do is you will toggle over onto this page where it says view here in yellow and double click, and it'll take you right to those notices. So it's just a quick and easy way to have those notices in one place for you. So our next page is how to enroll. You are going to enroll in benefits out on ADP's website, and most of you have gone out last year and done that. As you can see on this page, there is the open enrollment dates from 6/8 to 6/14, which is next Sunday. We are having an active enrollment. And what that means is because we are changing your insurance plans and your insurance carriers, your plans you had from last year will not just automatically roll over and be in place. You will need to select new medical, dental, vision, and your voluntary benefits. You will also need to click on, if you're not selecting them, on a reason for your waive. So you click on waive, and then you put in one of the reasons that in the drop down. So that's just a little bit different this year than you had last year. And so again, I had mentioned earlier how you enroll. You're going to go out to log into your ADP website. And if you just follow the instructions on this page, it'll take you right to where you need to go. And again, you'll follow the wizard through your enrollment screens. And do we have anything else, Sally or Karen, that we need to make sure everybody's aware of for enrollment out on ADP? Did we cover that enough?
Yes, I think so.
All right. So the next page is a page that I like to point out to everybody, and that's our medical care information. And why this page is here, it is to help you to be an advocate for yourself, to help your costs stay down. For example, you have many options for care. You can go to urgent care, you can go to utilize the virtual care, you can go out to the emergency room, you can go see your PCP. Each one of those will carry with them a different cost copay for you. So we always say, if you know you have a sinus infection, if you can just go online and do virtual care, that is a $0 copay. And you will go through the steps on the website. You will see a physician and or a licensed licensed medical care professional. They may be a physician, they may be a PA, they may be a nurse practitioner, but they are licensed to treat you for what medical needs you may have at that point. So for anything minor, colds, sore throats, sinus infection, things of that sort, we suggest going out to that virtual care and not having to pay a PCP copay. And then you'd go out to your primary care physician, of course, for, if you have the flu or things that are a little bit more severe. You'll try your physician, your PCP. A lot of times we can't get to our PCP. We can't make an appointment. They don't have anything available. And so then we suggest then going out to urgent care. So again, your cheapest or your most economical is to go to virtual care. Then your next would be to go to your PCP and then on to urgent care, which will cost a little bit more, but it's still reasonable to go to seek any kind of help. If you have, a break, a sprain, things of that sort, urgent care is wonderful for those types of things and for fevers and things like that. Lastly, we say is to go to emergency. We want you to reserve the emergency room. It's the highest cost for you. But also we want you to reserve that for very serious emergency reasons to go there. Life or death, I guess, right? But it doesn't have to be that severe. But broken bones and major things that need to be taken care of, heart attacks, if you're feeling off where something might be wrong. And again, I'm not saying don't go to the emergency room if you're used to going there. I just, by all means, if you feel that you have a need to go, please go. I'm not saying not to go there. I want you to get the care that you need, but I'm just trying to look at it on a cost point of view. So try, virtual care, PCP, urgent care, and then emergency room as a last resort. Or if it's an emergent need, then obviously you'll go there first. So that's just a little bit about what that care page is all about. It's about saving you some extra copays and money that way. Our next page is our new medical plans that we now have through United Healthcare. And what we have done is we have mapped these plans to become to be very similar to what you currently had with your Florida Blue. Your Plan A, your Plan B, C, and D with Florida Blue maps over very similar to these plans, with the exception of Plan B, which is our surest, United Healthcare surest plans. And I'll go over that. That's a little bit different than what you've been used to. So Plan A runs like a PPO plan, and it's what United Healthcare calls their EPO, but it's a type of PPO. You would be more familiar with it called a PPO. So you can go see any provider you want as long as they are in network. There is no referrals that is needed. And the copay is insurance pays 80% and you will pay 20% copays. And if you just follow it down the list and, just for sake of time, I'm not going to go over every line item here, but you can see the different costs. You have a zero copay for virtual care, $10 for primary. As you follow through your X-rays, you have to meet your deductible first for X-rays, and then 20% copay. And as you just follow it down, your prescription coverages are, the $10 to $50 and 85, and that is for generic brands, preferred brands, and then lastly for specialty drugs. And then you have your high-end specialty drugs that will be with the same tier at the $85. So that's just that. And one thing to keep in mind too, if you do use the mail order system, you will save a little bit on your prescriptions that way because you'll get a 90-day supply for the cost of 2.5 times a 30-day supply. And finally, at the very bottom of the screen, each column will show what your payroll deductions are per pay. So you can look at it that way. Plan B that's our new plan, a plan that you may not be necessarily familiar with, and it is from United Healthcare, and it's their surest division. And what that means is what they do is they want you to be an advocate for your own healthcare, and that way you get the best costs associated with your healthcare. So what you will do is you will go out and you will download an app, the surest app, out onto your mobile device. And what will happen is, mobile device or iPad, so you'll download the app and you'll go out to the app and you will view providers. You will kind of shop providers. So for example, if you're looking to go see a PCP, if you look down in column B under PC primary care physician, you see a range. It says $20 to $150. And what that is there's a range of a cost to go see as a copay to go see that provider. So how you'd know how much the provider costs in that range for you is you would go out to that app and you would locate a PCP by zip code, by an address, and then you can see a variety of names of PCPs and what they charge, what their copay would be for you to go see them. And so what you're doing is you're just trying to shop your best copay. Now you may have a PCP you've used for many, many years and you're comfortable with. Their copay may be 110, 150 versus someone else that could be listed, maybe only a $10 copay. So then it gives you the choice. Do I want to go to the PCP I've always gone to? Or do I want to start going to this PCP who will cost me a lot less out of pocket? So that's kind of how it works. And if you follow it down the list, you'll do that for primary care, for specialists, for urgent care. There's also a range for your diagnostics, for lab work, for things, for inpatient hospitalization for different things. So if you just take a look, it's what they want you to do is just go shop the plan, shop your providers, and to determine what makes sense for you, for your cost, for your budget. And so again, it's something you can tailor to your own budget, and it's an interesting concept. And those enrollees who have it love it. They love the idea that they can save some money and not be stuck with a $10 copay or a $100 copay for their primary care physician. They found one that was $5 or $10. So just wanted to pass that on to you, how that kind of works. Plan C, it runs like what you're used to. Last year you had HMO plans, which are narrowed networks. Okay, so what it is you have a doctor that is contracted with United Healthcare. And so they are part of an HMO group, and that's what the NHP stands for. That is the network. It's an HMO network. So you'll go there and you'll get that is your most cost-effective plan. So you'll get a lot of your care at the most reasonable cost because you stay within that network. Are required to choose a primary care physician that you will use only that primary care physician throughout the year. Now you can change primary cares, but you have to let United Healthcare know when you do change your primary physician. And so you'll go and so if you look down at the list, everything is most economical on that list. But what I wanted to point out is this plan is a HSA plan, which is a high deductible health plan. And that essentially means that you will have to meet your deductible. Once you meet your deductible first, which is a 2,500 individual and a 5,000 family, then your copays will start to take over. So, for example, if you look at your primary care physician, you will pay until you reach your deductible, and then you'll pay a 20% copay of that office visit for that time. And again, if you look down a little bit longer, the same thing for x-rays. You pay your deductible first. Once you've met your deductible, then you will pay a 20% copay. So all of these 20% copays, because this is an 80% insurance coverage, 20% your responsibility. Once all those 20% add up to your individual or your family out-of-pocket maximum, depending on what you've enrolled in, as an individual or a family. So once there is, for example, if you are an individual, you have single coverage, and all your 20% you paid your deductible, and then all your 20%, including your deductible, adds up to $5,000, then your coverage, then your copays are taken care of by the insurance company. So that is always good to know. And one thing great about an HSA plan is that you contribute to the HSA plan with pre-tax dollars. So that means your money's going to go a little bit farther. So you can take the HSA, the money you're depositing pre-tax through payroll deduction, can be deposited into your HSA bank. Your HSA is a health savings account strictly to use for medical. It is yours to keep. It does not, it's not a use it or lose it plan. It will roll over for life for you. So as long as you have the bank account, you can use it and funds in there, and you can use it for any type of medical expenses. The last plan is Plan D, which is another HSA plan, another high deductible health plan. But the contrast is this one is a PPO plan, where the Plan C is an HMO. We have that narrowed network. Choice Plus is that EPO that United Healthcare has that I said runs like a PPO. You'd recognize it as a PPO type plan. And the same thing applies. You'll use your pre-tax dollars to pay for any of your out-of-pocket expenses, your copays and things. This plan runs 90% insurance coverage and 10% your responsibility until you meet your out-of-pocket maximum, which is 4,000 individual and 8,000 family. Your deductible, and that will include your deductible, and the deductible is 1,800 individual and 3,600 family. And again, if you look down the list, you have, zero copay for virtual care once you've met your out-of-pocket maximum. So just kind of take a look. With all of these plans, preventative care is covered at 100%. And preventative care is your physicals. It is your female gynecological visits. It could be your colonoscopies. It could be gosh, I'm trying to think of it. Anybody else wants to jump in with some other
Mammogram.
mammograms? Thank you. But one thing I do want to make sure you're aware of, any of these outside of your physical, any of the other screenings that you're having done as preventative. You'll go in and have the screening as preventative. For example, you'll have a colonoscopy. That is covered at 100% preventative. But if the physician were to find something during your screening and then it turns into a diagnosis. Once it becomes a diagnosis, then that particular screening is no longer considered preventative and it will not be covered at 100%. You will be subject to copays as a result of that. So a lot of times that's confusing for individuals. They've gone for their colonoscopy and then they get a big bill. Well, they got the bill because they had a diagnosis from it. The doctor found something in the screening at that time. So it changed it from that preventative to an actual diagnostic test at that moment. So I just want to keep that in mind. If you ever wonder why your claim went up, why it's costing you more, it will probably due to the fact that it went from preventative care to a diagnostic. And if a situation like that happens, please reach out to myself or Angela, my teammate, and we'll be happy to research that claim for you to make sure that you are being billed properly. So, but I always just want to point out that little bit about, preventative can turn into a copay for you. So these are your 4 plans. Again, you can take a look at the cost. Your lowest cost plan is that Plan C, the HMO type narrowed network. Does anybody have any questions for me on any of the medical plans? Again, this is a very casual overview. Please feel free to unmute yourself and ask a question. I know we do have a chat, and Karen is monitoring the chat, as I can't see it as I am on this side of the screen. But Karen will monitor that and ask, and she'll reach out with any questions you may have. So please unmute or go ahead. And Karen, do we have anything in the chat regarding the medical plans?
I'm having difficulty seeing the chat with my, let me see,
Yeah, I
sharing my
can't see it at my end
screen.
either. Yeah.
No, there isn't anything in it.
Okay,
Thank you, Sally. All right. And again, please feel free to just interrupt me and say, Sharice, I have a question. By all means, this is just our casual conversation to guide you through your insurances. So now on page 9, this is where I had mentioned the Surest plan. That was Plan B. And this is what it just gives you an idea of looking at what would look like on your mobile device or on your iPad or tablet. Okay, the next page again just goes over some more Surest information. And again, you'll see it says for Plan B only, because this is only for that particular plan. Page 11 talks about your medications, and it talks about the mail order medications, which I think a lot of you are already used to, and you've probably experienced the online medical plans, or excuse me, medical prescriptions. So please just take a look at this. I won't go over that unless you have any questions on mail order. And again, that page 12 will give you your frequently asked questions about mail order in your pharmacy, any kind of questions you have about those. Surest, this is how Surest talks about on page 13, how they handle the pharmacy benefits as well. So that's just a flyer for that. Next, you will see a United Healthcare page, and that is page 15. And that just talks about going out to United Healthcare and using some of their digital tools, like their app on your mobile device or your iPads or your tablets, as well as going out to the carrier's web portal. You can register, and I always suggest downloading the app. And the reason why is you can register, go out to that portal, and you can view your claims. You can view where you are with your deductible, your stance, how much you've used towards your deductible, how much you have deductible left to pay. It'll show the different treatments you've had, the different doctor's visits. It'll show those types of ideas on there. It'll give you ideas about coverage, where you are with your coverage. You can specify, you can ask questions of searching my coverages and things of that sort. So it's a really handy tool to take advantage of. So I definitely suggest downloading that. The next page, page 16, talks about that virtual care. And so it gives you a little bit information on that and how to obtain virtual care. And we had talked about that in the beginning. Page 17 talks about your United Healthcare rewards. And I believe you had something very similar with Florida Blue last year. So what this is they track and they give you credit, cash dollar credit towards different things that you meet. For example, you took their healthcare survey, right? They're going to give you $15 towards that to spend on your on a Visa type gift card. There's also, your annual checkup. If you've gone out and gotten your physicals, you get $25. Any kind of certain type of screenings, $50. And there's a complete list out on United Healthcare web portal. You'll be able to see a complete list. So, or you can always, again, ask myself and Angela, and we can go over a lot of this stuff in more detail. Again, this is just an overview, and I can go in more detail if you reach out to us. But please take advantage of these things. And, I always hate to see people leaving money on the table. It's free money you can use towards anything you want. It doesn't have to be used towards medical. It's money that they are giving you. All right. Page 18 talks about OnePass Select. And what that is, that is sponsored through United Healthcare. And that is kind of a wellness app to go out to for movement, for physical. They have different types of nutritional recipes out there. It talks about nutrition, what you should and shouldn't eat. Talks about how much water you should intake. It also gives you different routines for a workout at the gym, a workout at home. So it's really interesting. It really will help you to look at different insights about your health through this OnePass Select. So I definitely suggest you going out there and taking a look at that out on the app. And our next page is page 19. And again, that just goes over the Employee Assistant Program. So it gives you a little bit of the information on there. It gives you a phone number to call. And again, it's completely confidential. So I definitely suggest you utilizing that free plan from United Healthcare. And same thing on page 20, just continues with that. Page 21 talks about your healthcare questions. You can go out to United Healthcare's customer service, and you can learn a little bit about your healthcare. You can ask questions about plans and all sorts of things. So they're just telling you how you can connect that way through virtual options. And again, the rest of it is virtual options through SureUs. There's just some informational flyers regarding all of your medical plans. Page 25 talks about your health savings account, and that's what I mentioned earlier. If you are enrolled in either Plan C or Plan D, you can enroll in a health savings account because you have to be enrolled in a high deductible health plan. And your health savings account, I had mentioned it earlier, is that medical savings account that you keep for, you don't use it and lose it, you'll keep it. It's recurring as long as you're depositing money into it, and you deposit money into your health savings account through payroll deductions. And I know we have gone over that before, so I don't want to take up your time by going over that again. But here's just some examples. And the carrier that handles your health savings account is Health Equity. And you'll have gotten a little credit card from them. You can call them if for some reason you're having some issues with things being denied. You can call them. This is some information on Health Equity. And again, there is limits every year that the government sets for putting money into your health savings account. And that is due to the fact that it's pre-tax dollars. So they do limit that. So for 2026, you can contribute up to $4,400. And for individual and for family, you can contribute into that health savings account $8,750. And now, if you are over the age of 55, you can definitely add additional funds to your health savings account of $1,000 for the year. So it just helps you a little bit that way. All right, the next page is in contrast to your HSA is your flexible spending account. Flexible spending account you can use to pay your medical bills for your other health plans. And what that is you will deposit pre-tax dollars as well, similar to how you do for an HSA, but you'll deposit this into a flexible spending account, payroll deduction. And then the issue with I shouldn't say the issue, the difference with this versus the health savings is that you will lose the money, you use it or lose it plan. So you have to, whatever you determine during your election, that is the money that you have on your FSA. You have to use that before the end of the year. And this will run on a calendar year, so January to December. So you have to make sure that all your funds are used by the end of the year. And again, the government puts limits on this one as well. And you can see here on the FSA plan, you can contribute for healthcare savings account, $3,400 for this year. And then as well as there's a dependent care savings account. So those of you who have children in any form of a daycare, you can use it. And in fact, they've increased it this year to $7,500 for a limit for the dependent care. So this just gives you some more detail on that. And again, you can call me and I can go over the details on the FSA account as well. But just keep in mind, look at what your expenses are going to be for the year, whether it's medical expenses or dependent care. If you choose that account, that spending account, just determine how much you're going to need and, put pretty close to that amount of dollars in there so you don't lose the money. At the end of the year, if you're getting close and you have a lot of money left in your account or any money left in your account, there is a flexible spending website you can go to, and you can choose to purchase items from there through using your flexible spending account. And those are things like Band-Aids, over-the-counter, Motrins, Tylenols, things of that sort. You can, blankets, there's there's a list, there's thousands of things on the list that you can use if you have to use up any money that is left over at the end of the year. And now we are off to the next page, which is page 27, and that is your dental plans. So we moved from Humana that you had last year to United Healthcare dental plans. And part of the reason why we did move from the Humana plans is that United Healthcare was giving you all a discounted rates. Your rates have gone down because we added dental and vision through them. So you have medical, dental, and vision through them. And so they gave you more discounted premium rates for your medical, dental, and vision. So you'll see that all of those rates will have gone down from last year. And again, we mapped the plans to make them very similar to what you currently had. So you have two dental plans. You have an HMO type dental plan, which is your most economical plan, and then you have a PPO dental plan. So the HMO works very similar to what you're exposed to. It's a narrowed network. You have to choose a PCP, a dental PCP. And then one good thing about the HMO is that you have unlimited amount of services you could do. So there's no cap on how much the insurance is going to pay. As long as you stay within network, and you don't go out of network, you can see that there is, it's very reasonable cost and your copays are reasonable. So there is on that ADP website, when you click on the dental plans under, plan details, the additional details, it will show you this where it says here, see copay schedule. You'll see what that's all about. And so what that is, it tells you how much they will pay the, for fillings, for crowns, for extractions, things of that sort. So that'll be listed on there. And then you have your PPO plan, which is your higher plan. The PPO plan, that in contrast to the HMO, it does have a plan year insurance maximum. So the most the plan will pay for you is $2,000 per person that is on your plan per year. So anything past $2,000, so for example, you were having a bridge done, and your bridge came to $6,000. United Healthcare will pay the first $2,000, and then you will pay the rest. You'll be balance billed for that remaining $4,000. And again, preventative care, X-rays, and things of that sort is also part of that $2,000 limit. So just be mindful that you have $2,000, but your X-rays and preventative care will be included in that. So again, this is just how the two different plans work. One is unlimited dental, but again, you're going to have copays, and then PPO, you're going to have copays, but you are capped out. And if you look down, there is, for the PPO, there is a lifetime maximum for orthodontia, which is $1,000. And the dental carriers do reach out to each other. So if you had used up your $1,000 for orthodontics prior, they will know that, and they won't honor more. They won't cover your $1,000 for this plan. So just wanted to pass that on to you. And again, you can see the rates down below. And your most economical plan is your DHMO, or your HMO plan. All right, we're moving along to, before I go to vision, do we have any questions on dental? Anybody have any dental questions? Let's stop and do a break and find out. Or if you have any questions on the HSA plan, the FSA that we just reviewed. Let's take a quick look and see. And feel free to unmute and ask me any questions on any of them. Okay, I think it looks good. Are we okay, Sally? Any questions?
Nothing in the chat.
All right. Sally, is there any points of interest that you wanted me to make sure gets told to our employees?
You've been doing a great job covering it all now.
Wonderful. Great to hear. All right. Well, please interject anytime if there's something I may be missing. Please, I want to make sure they have all the information they need. All right. Well, with that, then we're going to move on to the vision plans, everyone. And vision plan, I always say, works like a discount program. You know, it's not like the medical plan where you have high coverages, it covers a lot. Vision kind of gives you just a break on your vision needs. So that's kind of how you have to look at it as. So the examinations here, there is only one vision plan, and you know, examination is a $10 copay, and if you follow down the list, you will see frames, what the allowance is for frames. You'll see that what the allowance is for lenses, and it works similar to the plan you had last year with Humana. You get your examinations one every 12 months, your lenses one every 12 months, your frames one every 2 years. And again, it's down below, you can see the reasonable costs. And again, the rates have gone down for this plan as well, compared to what you paid last year. Now, the benefits are a mix of from last year. Some things were covered a little more, some things were covered a little less. And so just take a look at that. But for the most part, you have you have good coverage, and you get great discounts through this vision plan. All right, any questions on vision? We are moving along, if we don't have any, to life and AD&D, which is accidental death and dismemberment. So the company gives you as a company sponsored plan your $35,000 basic life plan. So that's what this is. And so and this is the exact same plan you had last year. There was no changes to this plan. So you can just refer to this page for any information, as well as when you go to enroll out on your voluntary plans, you will have more information out on the Mutual of Omaha. When you hit additional details, you can look at some more additional details on your life insurance. So then next is voluntary plans. And a lot of times people know the voluntary plans, and I always refer to as, you remember the Aflac Duck commercials, right? So it's extra plans that you purchase. Now these aren't Aflac, but it's the similar type concept. You purchase these extra plans to go in to coexist with your medical plan, with your dental plan, to kind of help you in that aspect, to pay a little bit of your copays and things through these types of voluntary plans. And you have accident, there is hospital indemnity, critical illness on these plans. And you can see you can enroll yourself, employee and spouse, you can enroll employee and child, as well as family. So there's just a little bit more detail on these plans, how they pay for different services. You get extra money, you get, cash for to use towards ICU costs, to use towards emergency room costs, things of that sort. So they're great plans to have. They're very reasonable to enroll in them, and they do very well with paying for the extra benefits that you may need. And for the hospital indemnity, your employer pays for matches, I should say. So whatever yours is, what you enroll in, the amount you enroll in, they will match that for you. And that will help with any type of a hospital stay. So that's always a good one if you want a volunteer plan to purchase, because the company is helping you match that. All right. And Sally, I know you said originally started off because when you brought an HSA plan on board, it was going to help with helping with some of the deductible for different things.
Right. Was because all of a sudden it was these large deductibles So the hospital indemnity was a way in case you have to go, it would help pay for it. But it might be just easier for everyone to understand. So it's already built in. The employee fee is what it is. There's an addition above that the employer is paying.
Correct. Yeah, behind the scenes.
Right.
Now on page 31 is additional voluntary plans that are always helpful to have. And it is Legal Shield and Legal ID. Legal Shield is just what you see. It will give you legal advice on different types of things that you can come encounter with. I used the example earlier. I used Legal Shield because we have it for myself for my company benefits. And I used it. My son, we rented an apartment for him while he was away at grad school. And so we used it. We sent the Legal Shield, the contract of the apartment contract, and we had them review it, and they pointed out some things that they didn't like in there. And we were able to use that in negotiations with that contract. So we used it for, like I said, for my son for that type of purpose. And you can see there's some examples of what you can use Legal Shield for. And then you see the cost down below. And then there's also ID Shield, which is the same thing as the Theft Identity Shield. And then most of you know it by that name. And again, it will help you with preventative threats, as well as if you are, unfortunately, your identity has been stolen, it'll help you get through all the bureaucracy of that as well. And then there's that separate cost there for that one. So those are wonderful plans to have as well for voluntary plans, if you have it for extra in your budget. All right, coming near the end now of our plans, we're looking at, this is just a recap on page 32 of the Employee Assistance Program that is free to you through Mutual of Omaha. And so these are the types of things people call them for that are listed here, that are bullet pointed. And there's a phone number as well as a website to go to. And again, this is strictly confidential. Your company nor I will even know that you've utilized it. On page 33 is your 401k plan, and I know most of you are familiar with your 401k plan. That is not changing. That is the same plan as you had last year. And a point we wanted to make is that there is a video, an educational video that talks about the 401k plan that JCC would like for you to take a look at. It'll be out on the ADP portal. It'll be out there when you go to enroll in benefits. You'll see an option to click on that. And so please take a look and get some education on the 401k. It's always good to know a little bit more about our investing and the plan highlights for that. Anything else about the 401k and ADP, Karen or Sally, that you would like me to note for them?
The presentation is on the home page under the quick links. It says education on 401k. So if you could just look for it there, and it'll give you some more detailed information on the 401k plan.
Perfect. Yes, it sure will. All right. And lastly is just some frequently asked questions about that Pay Active, and that is that cash in advance that you have company, where you can do cash in advance of your payroll. But one thing I do want to point out to you is that if you do utilize this service, after you put an expense onto that credit card, your very next payroll, that money will be deducted automatically out of your payroll. It's not, do I want it deducted next? It automatically will be. So if you have a big expense coming up that you need your payroll check for, like like your mortgage, and you've utilized this card, that money is going to come out of your payroll, and you may not have anything left for your mortgage. So just be mindful if you're going to utilize it, what your big expenses are coming up after utilizing it, because you will be deducted on your very next payroll from your utilization. And that is kind of your benefits in a little bit of a nutshell, and a quick overview. And so let's open the floor for any types of questions. And again, if you have some detailed questions you want to ask me, or private questions about conditions or your medical, please reach out to me in that beginning. That first page is my phone number, as well as out on the ADP web portal. You will see my contact information as well, and we'll be happy to help you, with any kind of detailed questions to help you. All right. So let's see. Any questions out there, ladies? Do we see anything? Anybody want to unmute and ask? Why I'm here, I'm happy to help.
There
All
are
right.
no questions in the chat, so unless somebody has something.
You have all been a quiet group this evening.
Yes.
Oh, I do want to mention one note that I did not mention earlier about the switching from Florida Blue to United Healthcare. So we are switching obviously in the middle of the year, and your medical plan is a calendar year plan, which means it runs from January to December. So all of your deductible that you have met from January until July 1st, when your new plans become effective, that we do a deductible transfer. So we'll take what you've already spent and we'll ask United Healthcare to apply it towards your current deductible with them. So you're not going to lose any extra money that you've already expensed out there. So your deductible will follow you. So I just want to make sure I pointed that out as well. And I'm hoping I didn't leave out any other details. I think we've covered everything. But again, I can answer anything individually if we need to. All right, well, I'll turn it back over to Karen and to close out the open enrollment meeting.
All right. Well, thank you so much for your time, Charisse. It was wonderful. Lots of information. And if no one else has any questions, then we will say goodnight.
Yes, absolutely. And don't forget, your open enrollment closes on the 14th of June. So between now and the 14th. So make sure by next Sunday, you've gone in and elected your plans. Thank you, everyone.
Thanks,
Have a
Charisse.
Have a wonderful evening.
Thank you.
You too.
Bye now.